navigating the healthcare system isn't easy. At Advise, our goal is to be a community resource that helps engage and guide seniors through their health journey. According to a recent study, 86% of Medicare communications are too complex to be understood by Medicare consumers. In fact, 66% of insurers produce content that's more difficult to read than Moby Dick. This is compounded by the fact that more than half of Medicare consumers have basic or below health literacy levels. Advise is here to help seniors understand the what and why of Medicare. We provide a simple, trusted way for seniors to review their insurance options and enroll in a plan. But that's not all we do. Advise is a Medicare concierge agency that focuses on serving seniors within their community. We provide a suite of services that support the full spectrum of healthy senior living. These services include scheduling annual wellness visits, completing health risk assessments, and providing education on preventative care. We engage with consumers in groups and one-on-one. Our services fall into 3 primary areas: education, consultation, and enrollment. When we help a consumer, we earn their trust. That trust turns into loyalty and referrals, and loyalty and referrals turn into additional requests for service. The need for additional service is what keeps seniors coming back to Advise year-round. We engage with our clients an average of 10 times each year. 70% of these encounters have nothing to do with Medicare enrollment. 50% involve a prescription question, issue, or concern.
Earlier this year, we had a woman request an appointment. Turns out her husband had recently been diagnosed with Alzheimer's, and all of a sudden she was in charge of managing all of their personal finances, including their health insurance. So we ended up meeting with this woman 5 different times in person to help make sure that she was connected to the best health plan for her and her husband's current needs, as well as sit down and explain every piece of paper that she received in the mail and every phone call she received from her new insurance plan. We also helped her complete the phone call and paperwork needed to get a referral in to begin seeing a therapist to help her through this transition. Lastly, we were able to connect her with the social worker associated with her doctor's office to help connect her to the Alzheimer's support group in her community. This is just one of the examples of how Advise really delivers on the Medicare concierge promise, which goes well beyond just answering a question or two about an insurance bill.
Often, the education we provide to people is around what not to do. For example, just the other week we had someone come in whose wife was still working and he was on her insurance. We met with this gentleman and during our needs assessment discovered that in addition to his wife's coverage, he was also paying a Part B premium. When we asked why, he simply said, because someone told him he had to in order to avoid a penalty. Whereas many brokers would end a conversation with someone as soon as they learn he or she had private coverage, at Advise, we see every person as an opportunity for service. By taking this time to sit down with this client and complete our needs assessment, we're able to identify that he was overpaying by $1,620 a year, and we were able to help him correct it.
Advise is not your traditional insurance broker. Instead of focusing just on sales, we focus on sales and service. Instead of conducting our activities only part of the year, we provide sales and service year-round. Instead of selling or promoting some plans over others, we are health plan agnostic. Instead of requiring our staff to meet independent sales goals, our staff work in a team model and complete a 6-week training program to ensure concierge-level expertise. Our mission at Advise is to partner with physicians and pharmacies to provide a Medicare concierge-level service to their patients and customers.